Hi, I'm Dr. Navneeth Kumar. I'm a consultant spine surgeon at Athreya Hospital. Been working in this hospital for the past 1.5 years. For me, choosing medicine was primarily because I had an interest in medicine. Okay, medicine interest just doesn't come to anybody and everybody because we are not taught in our curriculum about medicine. We are mainly focusing on biology, physics, chemistry. There is no real curriculum of medicine as such. But I think the real interest to medicine came to me when my father was admitted with a heart attack in the year 2000 at Malya Hospital, where he was treated by Dr. Devi Shetty himself. So I think that entire ordeal of going through the hospital, meeting the doctors there, seeing what happens to my father and his recovery and everything is what inspired me to become a doctor one day. So I think that would be my main inspiration. Rewarding aspect of my work is to see my patients do well. That's the only thing. Okay, we all want that. Every doctor wants that. Everybody doctor wants their patient to do better than what they were when they came to them. So if my patient recovers well, it's a rewarding thing for me, and thankfully I'm able to see a lot of that in my practice on day-to-day basis, which is my main reward. Yeah, so memorable cases, quite a few. Yes, in my career there have been difficult cases which have really enlightened me, and some difficult surgeries which have gone on well. A lot of success stories are there, but being the theme is Doctor's Day, and I feel it is fitting to tell about one patient who really changed my outlook about life as such. So this happened to me during my FNB training. I did my FNB in spine surgery. It was a 2-year course which I did in Jammu Kashmir, and in my training we used to get a lot of patients with spine injuries. So traumatic spine injuries are unfortunately, medical science still doesn't have an answer to traumatic spine injuries. Patients are usually paralyzed for life. So I get a lot of patients. We used to get a lot of patients in our institute who were, fall from a second floor of a building or a tree or a road traffic accident. They used to have broken backs and a severe damage to the spinal cord, and they were usually paralyzed for life. It's a permanent disability. Even if we operate them on time, there is very little we can do. The patient tends to be a wheelchair bound for the rest of their life. So it is quite depressing, to deal with patients who are never going to walk again. Of course, it's going to be difficult for the patient as well, and also for the doctors. But one such patient, one amongst the multitude of patients we treated, was a 15-year-old girl. And even today, I remember her. I'm not going to mention her name, but this girl was 15 years old, and she fell from the second floor of her house. She fractured her back, and of course, she was paralyzed from the waist down. She came to us. She was brought immediately by her parents, and yes, we offered the standard treatment. We gave her the medicine, we gave her the surgery required, and post surgery, of course, we had to tell them that she's not going to walk again, and the spinal cord was badly damaged, as we found during the surgery. What was more depressing was that the patient was an aspiring doctor. She was in a 10th standard, and she was studying for her. She one day wanted to become a doctor. So it was even more depressing to break the news, and the parents, obviously, they were heartbroken. They wanted their daughter to grow up to be a great doctor, but now with this disability, everything was challenged. But what was really inspiring was the patient's attitude throughout the journey of her recovery. I mean, before the surgery, of course, she was in a lot of pain. She didn't show much emotion. But after the surgery, I could always find her in a peaceful state where she always had a smile on her face. She would sometimes even crack jokes during the rounds. She was always a beacon of hope, I would say. So that was really encouraging to see, and we even discharged her. She did well post-operative. Well, matlab, her wound healed and everything, but she was obviously paralyzed. So she kept coming for follow-up in the OPD. And this one instance where I had to meet her in the OPD, this was 3 months after her surgery. She came to me, and it was a routine follow-up, and everything looked okay. And I told her, "You're doing fine." And I also offered a little bit of a pep talk. I told her that you wanted to be a doctor, you can still do that. Okay, डॉक्टर बनने के लिए दिमाग की जरूरत है, पैर की जरूरत नहीं है. I told her that, and she also smiled. But her response was something tremendous. She told me that before this injury, I wasn't sure if I'm going to be a doctor, but now I'm pretty sure I'm going to be a doctor. So this sounded great to me, but then it was also odd. Why would a patient say that? I mean, this is a disability. This is something which is going to further, reduce her chances of being a doctor. But why does she feel confident that she'd be a doctor now? So I asked her, why? Why do you say that you are confident now that you're going to be a doctor? Her response really astounded me, and till date I remember what she said. She told me that doctor बनने के लिए, she told me in Hindi, I'll tell it in English. To become a doctor, one has to sit down and study. God has already made me sit down permanently. So all I have to do now is study. 50% of my work is already done by God. So I'm sure I'm going to be a doctor now. This response really brought tears to my eyes, because this girl was 15 years. She was half my age. And the maturity, the bravery, and tenacity she showed was something I've never seen in anybody else in my life. I mean, she taught me that there's no adversity too great for human spirit to overcome. She was telling that her adversity, her disability is going to be the reason she's going to be successful. So that is something I'll remember forever. And that's one memorable case I want to share. So in my specialty, especially spine surgery, there's a lot of misinformation amongst patients. Of course, see, majority of the spine surgery patients do well with just conservative management, with just medication, physiotherapy. But there is a large subset of patients who had significant spine problems who need surgery. But there is a lot of misinformation that spine problem is like a dead end. There is no coming out of it. There is no real cure. Once you are a spine patient, you are forever a spine patient, and nobody really recovers. That's not true. Okay, it takes a lot of effort from my end. So many patients I meet who need surgery, and I advise them surgery, they immediately recoil back and say no, I don't want it. And they tend to suffer with the problem, and they develop complications because they refuse surgery. So I think that is the biggest challenge in my field as a spine surgeon, is to break that notion in the patient, a preconceived notion that spine problems are a permanent and like a terminal illness. So patients need to know that there is a real solution of spine surgery, which will make them completely better. So I think that is the biggest challenge I face. So I would say nobody enters this medical field with a manual of how to lead life. Everybody has to go through a trial and error method. I mean, for instance, in my past, I myself have done that mistake of not having this balance. My personal problems have spilled into my professional life, where I've been rude to certain patients because something happened at home, or vice versa. I take my problems at work home and trouble my wife and kids for the same not kids. So it's very important to strike a balance. But what really helps to do that is if you have a life partner who is also in the same profession. My wife is also a doctor. So to a certain extent, there is a certain symbiosis or, a matching of wavelength. So we understand each other, so that, some days I may tell her that this is what happened at work, and they know that, okay, he's not in the right mood to be pestered with something, and they take the backstage. So I think a communication and, I would say a matching of wavelength with your life partner is very important to strike a work-life balance. But more importantly, it is your ability to compartmentalize. Your work should end at work and not be taken home, and your home should not be brought to work. So I think that is a very important thing. It's not easy, but it comes with years and years of practice. Important what I see nowadays is a certain we see many people who have been forced into the profession because their parents want them to, or their parents are doctors. So there is a certain pressure being put down on children by their parents. And these people who are pushed into the medical profession, they don't last for long. Maybe they finish their graduation, they finish their MBBS, and they say, we are done. We are not, I mean, so they are not really following the passion. So get into the medical field only if you are genuinely interested in it. Not because of XYZ factors, because your parents told you to, because your peers have taken medicine, or you feel it is glamorous. That should never be the reason for you to pursue this. Because, mind you, this is a marathon. Medicine profession is not something you read for 5 years and you're done with it. No. For example, me, to be a competent, independently practicing consultant in a city like Bangalore, I had to spend literally 14 years of my life. So it's a marathon. It's not a sprint. If you are ready for it, take it. But if you aren't, better not even enter it. Okay, that is the one piece of advice I would say to anybody aspiring to be a medico. It has its own rewards, yes, but it is at the end of the day a marathon. And if you have the tenacity and the mental strength to do it, please go ahead.